Second item which I've selected comes from Deputies Niamh Smyth and Holly Kearns. They wish to discuss the current restrictions, or to discuss when the current restrictions will be lifted, so partners can accompany women to maternity care appointments. Minister Rabbite, I take it, is here to deal with this. Deputy Smyth, then Deputy Kearns.
Thank you, Concordia. 2 minutes each, yeah. Minister, delighted you would stay on this air of the night to answer the question, and I'm sure I don't need to convince you of the importance of this debate and this argument, and it is really pitiful that, 19 months on or 18 months on, that we're still having this discussion about women and the very basic when it comes to healthcare in maternity services around the country. Now, we know there are 19 maternity services around the country, and it has to be said from the outset, not every maternity service within a hospital is as restrictive, draconian or dogmatic in terms of the restrictions. They're imposing, and it's important to say they are imposing on women. And I suppose the clear message that has to come out of the debate tonight is that we are now calling, as women of the Oireachtas House, the Oireachtas right across this House, are calling that we go back to pre-pandemic access for women, that they are allowed one partner into the maternity services and wards as they go through this really, I suppose, critical, crucial and emotional journey through our hospitals and hospital services. Minister, there have been 96,000 births since the beginning of COVID. That's not even to consider the numerous and thousands of women who have suffered pregnancy loss. We, as Oireachtas members from around the House, had the privilege of listening to women who are, I suppose, the campaign, leading the charge in the campaign on better maternity care for women right across the country. And some of those women relate heartbreaking stories of being through their second and third pregnancy journey during this COVID and during pandemic, and the impact that that's having on them. There are no happy stories coming from women who've been through the journey that it is, and as I said, it is important to say that not every hospital is, I suppose, draconian in their measures. I suppose the point that I'm trying to make is we are now 90% of our population has been vaccinated. We are now back to all being able to converse and have a debate within the Dáil. We have 40,000 back in Croke Park. We want back to pre-pandemic access for women and partners in maternity services.
Thank you very much, Deputy Kearns.
Thank you, Karen Corla. I think Deputy Smyth articulated it perfectly, and I think it's all of the women in the Oireachtas now are calling for this, and all well said, I think. But I first raised this issue over a year ago now, and since then there has been considerable changes, and we're close to most of the restrictions across all of society being eased now, with over 90% of 16s fully vaccinated. But restrictions still remain on accompanying people in maternity hospitals. Despite the opening of pubs, sports, offices, bingo, absolutely everything nearly, women are still expected to endure prolonged labour and care for their newborn alone. Not to mention the partners who have received oftentimes the most difficult and tragic news on their own in hospital car parks. There is a deep frustration and anger not only about this issue, but the inconsistencies from the government and the HSE. If you go onto the HSE webpage on hospital visiting restrictions, you'll find a significant difference in the restrictions between maternity hospitals and units, something I have been raising for the last year, the kind of postcode lottery in relation to this. And the goalposts have just continuously shifted every time I raised it. So it's shifted from being a HSE issue to a local hospital group one, to waiting for vaccine rollout, to cramped conditions in our older hospitals. The Rotunda Hospital was insistent on its restrictions until the outrage at the filming of the TV series, the one that was filmed at the times when partners weren't allowed in. And then, once that pressure came on, they miraculously eased them. Back in May, I think we all know now, the Chief Medical Officer, Tony Holohan, said there is no good reason in public health terms for maternity hospitals to restrict visits from partners. Then in June, Minister Donnelly said that all of the state's maternity units will be following the same visiting guidelines for patients' partners. But Minister, now at a stage where some women, like Deputy Smyth said, are going through their second birth during the pandemic alone, and the approach taken over the past 12 months, it just hasn't worked. So I'm asking if you can please gather all the heads together and just, really try and address the situation once and for all.
Thank you, Deputy Kearns. I think in fairness to all Oireachtas members, but it's fair to say to the female members that you have our absolute and total support in your demands. That is the male. You have the total support of the male members. That is.
It's confusing then for people looking in that all of the female Oireachtas members, all of the male members want this, and yet it still hasn't happened. And what, why is that the case?
Light on that for us now, I'm sure.
I get all the good ones, Karen Corla, of delivering news, don't I? So I'm taking this evening on behalf of Minister Donnelly. While I will deliver his script, I have my own opinion as well, which I'll be happy to share with you. So I want to thank the deputies for raising this important issue, and I welcome the opportunity to discuss the topic on the floor of the House today. It's not the first time, Deputy Kearns, that I've answered this question. I think it might be the third time. I think I've answered it already to Deputy Neil Richmond before, and I think I answered it once as well before to yourself. So this is my third time, Can Corla, to answer. And I want to begin by assuring the House and the deputies present that I completely understand and recognise the concerns and the anxiety the restrictions has caused to women and their partners over the course of this pandemic. The importance of partners attending with women at maternity appointments is well recognised, including by everyone working in the provision of maternity care. At the same time, the advice is that the potential for COVID-19 to spread in maternity services continues to be very real, and the highest priority must be given to protecting the health and the safety of the women and the babies in our care. The HSE guidance on attendance at maternity hospitals aims to manage that balance while reflecting its commitment to providing increased access for nominated support partners. And I am heartened to see that many restrictions have now been reduced and that there is now greater access for partners of women accessing maternity care. And the clinical guidance has allowed for a broadening of that access, while at the same time ensuring maternity services continue to provide care safely and to protect women and their pregnancies from COVID-19. The latest guidance of the 3rd of September sets out that controls on the access for partners should be the minimum required to manage infection protection, prevention and control risks, and any restrictions must be clearly explained and should be applied with consideration for individual circumstances and needs. And I think that's something that really, no matter where the hospital is or what the outbreak is, that individual need should be taken seriously into consideration. The updated guidance deals with facilitating access for nominated support partners where women are attending for antenatal care, during labour, childbirth and in relation to postnatal care. Should a hospital place any additional limitations on partner access, the guidance stipulates that those restrictions should be based on a documented risk assessment that is reviewed regularly and is readily available, for example, on the hospital's website. So there should be no contradictory evidence between the Department of Health and any of the 19 maternity hospitals around the country. So if there is an outbreak of COVID, the department would need to be notified, would need to be aware of it, but it cannot be done on an ad hoc basis to actually suit whatever is the political agenda within any particular maternity hospital itself. To ensure that current situations is clearly communicated, the HSE is advised that hospital groups continue to update their website to reflect the current position, and that is now publishing on the website. In addition, arrangements are in place for each hospital group, director of nursing and midwifery to monitor compliance so that access for partners and maternity services is facilitated and is consistent with guidance. To the deputies who raised this question this evening, I did indicate to the department I might have to move a little bit off script, because I think it would be unforgivable with me to stand here tonight and not to recognise the fact that one particular hospital allowed a TV company in to film, while at the same time the partners sat either outside in the car park or sat in a local in their cars waiting to see actually how their partner was progressing in labour, or worse still, actually having to find themselves not in a delivery position, but actually after getting the horrific news that they were actually after losing a child. I think it's time now for the 19 maternity hospitals, and we need leadership within this, and we need the hospital midwifery section, which is normally led by women, to stand up and take ownership of it and come forward and actually bring the maternity services into line with how we're actually doing infection protection and prevention in all other parts of the health system and maternity.
Smith.
Well, thank you very much, Minister, and I know you obviously feel very passionate about this, and it has to be said that both the Taoiseach and the Minister have stood up and said that this is not on. They have called on the hospital directors and masters within maternity units to get on with it, lifting those restrictions and allowing partners in. I suppose it would be remiss of me not to say that my own hospital in Cavan General Hospital, not everywhere is lucky enough to have a maternity unit, are allowing partners in. And one of my own staff who's currently going through that journey and having a lovely experience, and her partner's been allowed in with her. There's a midwifery-led unit there, and there's loads of reasons that they could come up with as to not allow the partner in, but that's not the case. They are, and every hospital should be working in the same vein to allow partners in with them. It's important to say it's not just a women's issue, it's a family issue, and as the Cancord has quite rightly pointed out, the men or partners who are left in the car park feel equally upset about this, and their voices have to be heard in this debate as well. I just want to make this point, Minister. There's an opportunity here. We've seen an explosion in home births. I have a cousin who's gone through this herself too because of COVID. She chose to have a home birth. There is huge leniency towards that. There's an opportunity here with the department, with the HSE and maternity services, to embrace that and to nurture that and to allow women have that choice and make that more readily available.
Yeah, thanks, Minister, for your response. I think we all appreciate the complexity of the situation. We all know as well that there's nobody, I think, who has the interests of the health of the newborn at heart more than the expectant parents or the new parents. And I think they just deserve as much certainty and clear guidance as possible and support from a partner through all stages of the journey. And that needs to happen immediately. I suppose, like, just, you know, we hear that, oh, the Minister has called for this and the Taoiseach has called for this, but then in the Minister's statement that you read out on behalf of him, it says things like, should any hospital, you know, there's kind of these stipulations added to it. So I just want to reiterate what I said again earlier, which is that the CMO said there is no good reason in public health terms for these restrictions. So it's kind of like it can't be a bit of both. I think we have to be really firm on this now because it's going on for so long. And like we said, the second people going in. And one thing that did happen last December, was that the HSE reclassified partners as essential accompanying persons for the purpose of the 20-week scan. Do you remember that? So maybe we could reclassify partners as essential accompanying persons for the entire maternity journey. So no matter how restrictions are being looked at and re-looked at, that remains the same, because we're talking about giving rise to risk, and we've had this conversation before. If your partner has brought you to the hospital in the car, you're arguably already a close risk, a close contact, and the percentage of vaccinated people, that I would encourage you to look into reclassifying partners on a permanent basis for the entire maternity journey.
Can you conclude on this very important matter?
I certainly can. Corla, I think I'm aware tomorrow that Senator Doherty is actually having a meeting with the HSE, and I think we all, female members this evening, have signed a supporting document, including the two ministers within the Department of Health have also signed it, along with all other female ministers as well, have given support on it. So I would call on the HSE to meet with the female members of the Oireachtas tomorrow evening and to take on board all the suggestions and to show leniency and tolerance and empathy to the women coming before their maternity wards. Thank you.
Thanks to you, Minister, and to the Deputy for raising this important matter. Well, yeah, I can most
don't know if the rule
in the circumstance.
Just to put on notice that in addition to that, the women of the Oireachtas have agreed to bring this up at every opportunity until it's agreed. We brought it up at the Public Accounts Committee last week, QPL today, this evening, and we will be bringing it up every day.
Facilitate you raising it here as often as you like.
Same in the Shannon.
We move to the third